nervous that at my age I may not come out in one piece, but I did, and it was refreshing. It was a lot of fun, so I'm glad that we were able to do that, and I suspect the children may tell you a little something about that as well.
So we do have some photos to share. We named this program Whales to Water. As many of you know, the mascot at Willett is a whale. So why not use that and parlay that into a theme here? You can see through some of the photographs, some of the instruction that's going on, smiles on faces of our students. And we're just lucky to be a part of this. And even though it's a pilot, I'm hoping that we'll go on into the future. So I'm going to move into a video, and then we'll turn it over to Kelly Bergeron from TV and Radio Broadcasting.
The second graders at Willett Elementary School in Attleboro have been visiting
the YMCA weekly for swimming lessons in place of their typical gym class, forming a connection within the Attleboro community.
So it's nothing like a normal gym class, but this is exactly what many of the kids need. If you look at this list, a lot of the kids have never even been in the water, so it's a life skill, so it's really important. I think it's great.
So it began this summer in a conversation that Mrs. Regan, our assistant superintendent, was having with the executive director and program coordinator at the YMCA, and it evolved from there.
I think that the more that we collaborate between the schools and other community organizations, the more that we show our children, our adults, everyone else that we're all in it together.
The students all started with different levels of experience and are each learning at their own pace.
They're all at different levels. So some kids are working on like stamina, some kids are working on just like dunking their heads and, getting comfortable in the safety aspects of just swimming.
Not only are the swimming lessons great for the students' safety, they also have a lot of fun together.
We learned how to do kicking. We had to hold the wall, and we do kicking. And we do swimming. You put your hands on the edge of the wall, and then you kick off, and then they teach us how to catch you. We learned how to swim from one side of the pool to the other side. And how to do a backstroke. I do like when we do a rocket thing, we did this and then we swam to the wall.
The Willett students have all drastically improved and have become more confident in the water.
I've seen a lot of growth out of several kids, and then again the comfort level, and it's really important to learn how to swim. So some kids are getting much better, some kids are just getting more comfortable, and then the skills will come after that.
Like anything else, when we build a partnership between the schools and our community, it's nothing but positive. And the students are better for it in terms of being able to go out into the community, participate and swim with members of the YMCA and our staff. And all in all, everybody's in a better place for it.
I'm Megan Barrows, and this is Blue Pride TV.
So at this point, I'm going to turn it over to Kelly Bergeron from TV and Radio Broadcasting.
Thank you. Don't be shy. Good evening. I'm Kelly Bergeron. First, I'd just like to say how excited I am to be a part of this new CTE program at the high school, and looking forward to the new space next year for sure, as I'm sure are they. When Lori approached me about doing this video story back in September, I knew it would be no small feat for my first year students. However, much like the students at Willett, they dove right in, and I was blown away by their teamwork and the dedication and just the willingness to learn and just to jump in and, kind of get their feet wet. Sorry, that one was not intentional. It just kind of came to me. So it was a team effort. We went as an entire class over to Willett. We shot all the video together. This particular video that you saw was scripted, as you can see the 3 girls that are with me today scripting there, and edited by these 3 in particular. So they're just going to share a little bit about what their experience was. So Izzy.
As she said, I'm Izzy. Ignore the attire. Clearly I did not get the memo. But I thought that this whole project was actually a really good opportunity, because I used to actually go to Willett, and seeing how the community has really changed and how they've kind of added this whole new educational thing. I think it's actually really great. And it kind of makes me kind of envious, because I wish, I got to swim when I was in 2nd grade, but we all got to get what we want. Working with Megan and Ariana for this project was honestly a really fun task to do, and they're really good people, so yeah. I think that overall this is something I would definitely want to do again, and this whole, sorry, I'm just a little bit nervous. But yeah, this whole community thing and project was actually a really good, oh my god, I'm getting all nervous. Sorry.
It's okay.
Yeah. As I was saying, I think that doing this whole entire editing video software was actually a really fun thing, and I enjoyed meeting with the students. And I enjoyed interviewing them and seeing the staff again at Willett, and I think that I'm really hoping we can do something like this again. So, yeah.
Thank you.
Sorry. That was really bad.
Thanks, Jess.
I'm Ariana. I really enjoyed this trip and experience, because not only was it really great to go out into the community, it was a really good learning experience for us all. We learned how to script and how important it is to organize all your ideas before you dive into editing. And once you organize everything, it's so much easier to begin editing, because you know where to start and end and how to organize all your ideas. While scripting, I tried to highlight the positive impacts that the Willett students going to the Y had on the community and the students themselves. And overall, I think that the experience was really great for us all to learn on the job and learn the skills along the way.
Yeah, I'm Megan Barrows. When I was putting together the script, putting together the story in our editing software, it was my goal to pick pieces that really highlighted the sense of community that this whole program has created. I wanted to highlight a lot of the sound bites from the kids and the staff members, because they made a lot of good points about all the positive outcomes that have come from this, between the kids learning how to swim, between just people getting opened up to the activities that they have access to in the community. I wanted to include a lot of that. And also them swimming in the pool and just them having a really good time. I wanted to make sure that when we were interviewing the kids, they all seemed to really, really love the program. So,
Awesome. Thank you.
That's wonderful.
Thank you very much.
Outstanding.
So next we have the Willett students to share their experiences with you.
Hi, everyone. Hello. Thanks for having us. I'm Andrea LaMonica. I teach at Studley 4 days a week and Willett 1 day a week. So I was really excited that one of my days at Willett, I was able to get my hands on this program. As soon as I heard about it, I was like, I need that on my day. So I was fortunate enough that they were able to help me out with that. So I had brought some of our friends today with us. So we're going to ask each student a question, and they're going to give you their response on their experiences. You guys ready? Okay, so my first question is going to be to Jack. Jack, tell us about how you felt about swimming before you took the swim lessons.
I felt very, very nervous.
And after your 8 weeks, how did you feel about swimming?
Very safe because my teacher was there for me and my friends.
Awesome. Is there anything else that you would like to share about your swimming experience? Maybe a success that you had?
And I also learned how to tread water for 60 seconds.
And the first time you treaded water, how many seconds did it take? Were you able to tread water?
10
And then how many seconds at the end of the 8?
to 60.
That's awesome. And my next question is for Morgan. Morgan, what was your favorite part about swimming at the YMCA?
Jumping into the pool and also doing a back float.
Okay, and what you jumped into the pool? Did you guys do a sit dive, or did you do a cannonball?
Dive.
You did a sit dive? Awesome. Good job. And Jacob, what were your favorite moments from swim lessons at the YMCA?
My favorite moment was when I got to jump in the pool.
And what was your favorite jump?
My favorite jump was a cannonball.
Do you think your splash beat any of the opponents, like Mr. Kate and Ms. Briley or myself?
No.
No? Allison, what were your proudest moments?
When I swam the whole length of the pool by doing the doggy paddle like this, doing the backstroke like this, and doing the crawl like this, and swimming underwater and doing this. And with all of that, I swam the whole length of the pool.
And the pool, what's the distance for the pool?
25 yards.
That's awesome, Allison. Good job. And my last, do you have anything else you wanted to share? Jenna's, okay. So Jenna, what was your bravest moment?
When I wasn't so good at the butterfly, and I got better and better every time we practiced it.
Now, do you remember what the butterfly stroke looks like with your arms? Because the butterfly stroke is not an easy stroke.
So you put your feet to the back of you,
Yep.
keep them straight, and try not to bend your knees, and just flop like you're a mermaid.
So your legs look like a mermaid, and then did you practice the arms or just the legs?
We practiced the arms, and this is what they were supposed to look like.
Awesome. Good job. That's a tough one. Does anybody else have anything?
I have another one.
What was that?
So you know how Miss Riley said that she jumped in earlier?
Yeah.
Well, her earring fell out.
When she jumped in the pool, her earring fell out?
Yeah. And I went down to go get the earring, and I got it.
So wait, you had to swim under the water all the way down. And how deep is that? 5 feet?
Yeah, 5 feet.
Good job.
Good job.
And Jacob, what would you like to share?
I also like to stick my face in the water.
You did a good job with that. Good job.
It's hard to do.
Allison?
I really like the go in the water and just swim, go underwater, and just do anything.
Just to get in the water was a fun opportunity, huh?
Yeah.
A little different than what we typically do in class.
Yeah. But just to be free in the water.
I get you. Good, you guys all did awesome. Thank you.
So I'm sure you're all wondering what's next, what's going to happen after this. So that's the final slide for Lee, Andrea, and Joe.
That's a really tough act to follow.
That is.
Just Joe. Joe.
I just want to say the video that the high school students did was better than the one that the TV station did. Really very, very good. Anyway. So what's next? There's another 8-week session. It'll actually span 9 weeks because April vacation's in the middle, starting April 11th. So we're really looking forward to having the kids back. Some of them will have moved up from the level they were at to new levels, including my friend Allison. She did swim the whole length of the pool. She was really good. So that's the next thing. In the interim, what other programming is there available? The first thing is the Y offers a sliding scale for membership and programs, and we offer swim lessons starting every month. So we're hoping that some of the children will be able to join us in between now and April. It's school vacation weeks in general. We offer a program called Safety Around Water, and that is a no-charge program. It's funded by the Jonathan Stout Foundation. I'm sure you guys all know who Jonathan is. So that will be offering that Christmas week, and February vacation, and April vacation. And we last offered it the week before school opened in August. So there are some opportunities for the kids to get in the water again, and so they keep their skills and improve a little bit more, perhaps. So then Lee's going to talk about how we're going to fund the future.
Next step. So as a staff team, we are working on securing funding for the possibility of having all of the second graders district-wide come in and have swim lessons at the Y for no cost. I think that's the important piece here, is that we find the funding so that the kids are guaranteed that opportunity to learn to swim, and they'll come out of their second grade school year as safe and confident swimmers. So we have applied for a few different grants, and we're looking at some donors for additional funding, so more to come on that. But again, I just wanted to say thank you, Joe and Andrea in the water every single week, and that's been wonderful. And you know, the support of this Willett team was really great. These kids were fun to work with, and we really felt privileged to be able to see them in our Y every week. So thank you.
Thank you so much.
Thank you.
Thank you.
Anyone, Mr. Storrs?
Thank you, Mr. Chairman. I just want to say I love these kind of community school connections. That to me, that's what community is all about. So what a great thing, what a great program. To our teaching staff and to our students, but especially to the YMC for helping make this. And whoever's idea it was to get the high school students involved, genius, absolutely genius. So thank you, and great job.
Thanks.
Great.
Here, Mr. Geddes.
Thank you, Mr. Chair. Thank you to the YMCA. Mr. Storrs said it perfectly. These community partnerships are absolutely incredible. And this is just one way that the YMCA has helped the Attleboro Public Schools. So thank you for that. The question I did have was related to potential for spreading this to the rest of the district. So since you've already answered that part of it, if someone was interested in trying to donate to support this, going to the rest of the schools, how would they go about doing that, and who would they contact?
They would contact me. My name's Lee Fonts, and I am there Monday through Friday every day. They could just give us a call or check out our website. My email address is on the website. It started as a pilot program. Well, it was the easiest school to start with because of the close proximity to the YMCA. So there's a little bit more work that goes into busing students from a school a little bit further out, but we're confident that given some time, we'll get there.
Anyone else with any comments or questions? And I'll just thank you, echo what my colleague said, and thank the Willett contingent that's still here as well for this program. I think it's great. It's great for the kids. It's great for the school department to partner with the community. So very well done. Thank you very much.
Thank you.
Thank you.
Thank you.
Thank you.
Have a good night.
Good night. Thank you.
Thanks so much.
Is that over?
Thank you, everyone.
Thank you.
Have a good night.
You too.
Get that right?
All right, next we have our Around Attleboro update from our Student Advisory Council.
Thank you.
Good evening. This week's All Around Attleboro segment contains important information regarding the end of November.
For this week's SAC shoutouts, we're congratulating the AHS cheerleading team for placing third in the Division I Regionals competition. For our elementary schools, Hill Roberts is having their PTO meeting on November 16th at 6:30 p.m. Hyman Fine is having their Fall Spirit Day on November 19th. Show your spirit and dress up in your favorite fall colors. Studley's PTO meeting's running on November 17th at 6:30 p.m. and Willett's having their PTO meeting on November 18th at 6 p.m. This meeting will be virtual. Thatcher will be partnering up with St. Joseph's Food Pantry for their annual food drive, which is running from November 15th to December 3rd. Donate any non-perishable foods to help out the drive. For our middle schools, Coelho's PTO meeting is on November 17th at 6:30 p.m. They will be meeting virtually. The Wamsutta PTO meetings are running on November 18th at 6:30 p.m. in the school library. Coelho will be partnering with St. Teresa's Food Pantry for their annual food drive from November 15th to November 3rd. Make sure to help out the drive by donating any non-perishable foods to help the school.
For the high school, the music department's virtual info session is happening on November 17th at 6:30 p.m. Our Powder Puff football game will be happening this Friday at 6 p.m. The AHS Drama Club will be having their senior district auditions on November 20th, and it's a great opportunity for any students interested in drama or production. This year's Thanksgiving recess will be happening from November 24th through the 26th. For all winter athletes, winter sports will be starting on November 29th. And lastly, senior pictures are due December 4th, and Chestnut Hill will be visiting Attleboro High School if you'd like your pictures then. More information regarding this is in this week's Blue Mail from Mr. Rooney. For community engagement, the Blue Pride Ambassadors Club is hosting their online Palooza in December to benefit the Varsity Booster Club, the music department, and the hockey program. Follow BPAC on Facebook or see Mr. Rooney's Blue Mail for more details. Yearbooks are available for pre-order, and if you'd like to put an ad in for your student, you may do so here. This concludes our segment on All Around Attleboro. Thank you.
Thank you very much. All right, before we get into the bulk of our agenda, which is pretty lengthy, I'm going to just take a 5-minute recess. Actually, no, I'm sorry, 3-minute recess, just briefly, and then we will be back and get into everything.
That's okay. You didn't need to.
All right, we are back, and next we have a presentation from the Attleboro Health Department. For introductions, I'll turn it over to Superintendent Sawyer.
Thank you, Chairman Withers. At our last meeting, I discussed that in accordance with the policy that was set back in August, we needed to review the mask policy at this meeting. And part of that discussion, the school committee asked the administration to ask officials from the health department to join us. And they were very gracious to say yes. So we're very lucky tonight to have both Dr. Quinn, the health officer, and Jessica Horseman, the health agent, here to answer some of your questions as it pertains to the decision that has to be made at some point.
Thank you. Thank you for joining us tonight. At this point in time, I'll turn it over to the committee for any questions they may have for Dr. Quinn and Ms. Horseman. Ms. Johnson?
Sure, I have one. Thank you very much. Thank you so much for joining us this evening. As we know, after holidays, history has shown us that there's a potential for another wave or an uptick in cases locally. In your experience, do you see these upticks being driven among vaccinated or unvaccinated individuals? And regardless of either population, what can we do to minimize the risk in all populations of spread?
Dr. Quinn, would you like to speak or would you like me to speak?
Sure. I think it's just history has shown us that there will be an uptick. And, groups of people, there will be vaccinated and unvaccinated, and then we will see an uptick in both. Just by nature of how the vaccines are wearing off after a few months, and that's why the push for the booster shots. So it'll be in both. There will be an uptick just because we've seen it before, and now we're getting into year 2 of this. So I think that's pretty much predictable.
Thank you. And Doctor, what can we do to minimize the risk of upticks and best practices to stay safe?
Well, I would say that it kind of leads into the discussion of masking and continuation there. The masking clearly has a beneficial effect to stop the spread in those who are infected, to spray secretions into the air. So I think that's what the debate is now: is what's the optimal time after holidays upon which to stop the masking?
Question that I had, and I think it's a two-part question. One is, it seems to me, at least, and I'm not a doctor or medical professional, so it's just from what I read, that COVID seems to be here to stay, at least for a decent amount of time, if not for always. And so I want to know if my assumption there is correct, or at least that is what you guys believe as well. And also, there comes a point where we as a society have to move forward, despite the fact of benefits masking and other actions may take. Is there a point, I'm not saying we're there yet, but is there a point where any benefits of masking, are over by the downside from continuing to take on these precautions?
Jess, you want to jump in?
So it's very double-edged, I can say, from monitoring right now. Comparable facilities that aren't requiring children to mask if they're not falling under DESE or EEC, the Attleboro Public Schools are doing significantly better with their rate of transmission. I think we're going to get to that point, but we're still in a big, a lot of it's trial and error, and we are seeing an uptick in our numbers. We've been currently seeing a lot of clusters in the school-age children and whatnot going on. So Interimly, I still think masking is going to be the better option coming off the holiday season, at least through January, if not, through February vacation, to kind of get us through that point and really see where we're going to be standing after that.
Rob, Mr. Geddes?
Sorry, thank you. Taking notes here. First of all, thank you both for being here to join us. I do have a few questions, but before I get into those, I just wanted to clarify, Mr. Chairman, as we make any deliberation or evaluate the policy, will the guests be here for any clarifying questions? Not necessarily to participate in the deliberation, obviously, but just to answer any questions that come up during our discussion? Or is this our only opportunity to ask questions?
I believe this is our opportunity to ask questions.
Okay, thank you. I have there are three questions that I thought of before we get started. One, Ms. Johnson had touched on before that. I've always seen it described as the three best ways of preventing transmission being, first and foremost, quality air circulation, quality ventilation. After that, distancing, and then after that, masks. So that masks are kind of like the third and final line of defense. Is that an accurate description or an accurate prioritization of mitigating instances, I guess you could say, to prevent spread?
Yeah, I haven't really seen it prioritized. I've seen it more as listing because they all have their superiority when it's a particular situation. So, yeah, clearly fresh air is very important. Stagnant air, elevators, they've shown transmission where it's just very stagnant air. And then as far as the masking goes, the research has shown that secretions can travel further, both as droplet and airborne. So there's that factor. So it all depends how vigorous a cougher or sneezer you have there. So I don't really prioritize it. This is one, this is two, and this is three, but they're all very important. Jess, did you have anything you wanted to add to that?
No, we've definitely seen the benefits of masking in a lot of facilities that we've been monitoring, though. There's definitely a clear difference in usage versus non-usage at this point.
Thank you. My second question, since Delta became the more dominant variant, I guess that was late in the spring, maybe early in the summer, it was clearly much more transmittable among younger populations. But since then, at least last I saw, there haven't been a lot of final determinations on any long-term effects on patients under 18. Is that still the case, or have you seen any updated information about what potential long-term effects there could be?
Well, the severe case rate is so much lower in the young population, so you don't really have the numbers to drive, who has the longer term ill effects. They do carry. They don't have as the young population does not have as severe of illness, so they are obviously bunching together in groups a lot more closely because they're sharing things weekends at school in classrooms, so they're congregating a lot closer than a group of elderly adults, say, in a assisted living situation. So factors that go into it, but they contract it from one another, they carry it, they don't get as severe a disease, and we don't see the long haul ill effects because the numbers just aren't the same as the elderly, for sure, population.
Thank you. And then my last question for now, you somewhat touched on that there's a lower severe case rate among young patients. How frequently are you seeing situations where where there's transmission from one person to another just because the initially infected person only believed they were dealing with slight cold symptoms. You know, they were vaccinated, and so because the symptoms weren't as severe, they didn't think it may have been COVID. That's something I've heard about from others in workplaces where someone has tested positive, they've been at work and not realized just because the symptoms are a little bit less. Is that something that you're seeing frequently or not?
Yeah, that's hard to put a number on. The one caveat, I'll go back to the previous topic, was that it's generally less severe in children. Obviously, if there's immune modulating medications, steroids, a lot of these new immune modulating medicines, then those type of children can be at high risk. So I just wanted to have that one caveat. But, you know, Jess can probably speak a little bit to this from, you know, Jackie, our health nurse, has provided numbers of what goes on in the schools, and we'll see little crop ups of clusters. So clearly, you know, there are transmissions going on, and, you know, the numbers have been higher over the, you know, fall and leveling off to some extent. But Jess, did you have any thoughts that from the, you know, Jackie discussions and Deb Ebert from the school?
We've been seeing an increase in the clusters. It's definitely, you know, a little bit concerning, especially going into the holiday season and vacation season where these kids are going to be out doing activities. So we're definitely anticipating we're going to see an increase in those clusters going throughout November, December, you know, at least through early on in January.
And I'm sorry, just as a follow-up, you mentioned the increasing clusters because we didn't, if I remember correctly, we didn't have any official or confirmed transmission last year. We've had 3 clusters this year. Do you think with the lack of distancing that that if students were not wearing masks, it's likely that we would have had more clusters, or is that something you can't conclude?
Based on what we're seeing from comparable facilities in the same age group that are private settings, they're seeing a lot more increase in those clusters and widespread transmissions, which would lead me to believe if we didn't have a mask mandate in effect in public schools, that we would definitely see an increase in those clusters at this point.
Excellent. Thank you so much again.
Do we know how many, if any, children, I guess under 18 in Attleboro have been hospitalized with COVID since the school year started?
I don't have any reports of any hospitalizations in school children at this point. I can say under the age of 18 is averaging about 40% of our rate of COVID positives at this time.
COVID, but not, so you have no reports of hospitalizations?
Correct.
Mr. Storrs?
A couple of questions, if I may. So the first one is, when it comes to masking and in an educational environment, especially with younger students, are there any negative ramifications?
Oh boy, that's a loaded question.
That's why I asked it. Yep.
Yeah. Yes, there are obviously the socialization factor, just how kids interact for sure. So yeah, I think it's clear that there are downsides to it. Whether you get into the athletics portion of it, where people are trying to run races with masks, you know, that's another topic. I still think you get back to just keep it to scientifically driven, which is it's the folks who are infected that wearing a mask, it's beneficial. So I always can, you know, try to point out that it's really not those who are wearing it who are healthy that are benefiting so much. It's those who are ill and don't realize, you know, that it's not the common cold and it's capturing some of their secretions. So it doesn't spread to others in these kind of settings of school and elsewhere. So I think as long as the spread is going on and these clusters are coming up and people are congregating for, you know, the holidays, and there will be some bumps and spikes, I think the masks do have a role. But Obviously, I think your point is there are some downsides to it, and I think you have to recognize those as well. I think we all want to get rid of the masking, but I think at this point in moving into the holidays, I think that, you know, the benefit outweighs the cost on the socialization aspects and quote unquote getting back to normal.
So my follow-up question is, personally, I don't believe that the state is gonna. I think they're gonna extend it. I'd be floored if come January they drop it. And I think us making a decision now in November, 2 months out from where we may be in January, I think that would make zero sense. But my question to you is, if we were to try to make a decision on when masks should be on and when masks should be off, what would you base it on? Would you base it on community spread? Would you base it on in-school spread? Because with community spread, you have cluster areas such as assisted living facilities where, as we know, one person gets sick, and unfortunately, very often, almost every resident is getting sick. So that affects the numbers for communities. So how would you, or what number would you utilize to determine, and what value would you utilize to determine a good mask on, mask off? And that's if the state ever got to the point where they said it would be okay to remove.
Yeah, so that's an excellent point. And what's going to drive these decisions is your point. One thing Jessica and I, as health agent and health officer, were very clear with the mayor to want to work with the schools so that there's a unified message through the community, so we don't have folks going to a hardware store and, you know, having to mask up and then go somewhere else citywide, you know, city hall or schools and not, and just having a real confusing message. So to drill down into what's going on in, you know, one assisted living center, whether it's among the residents or there's a worker working in there spreading it to a number of residents. We just didn't want to have these mixed messages. We wanted to be very consistent, because in the end, I think that's having lack of confusion is going to be important for folks. And then as the masks get lifted, so to speak, I think that would be helpful to have it affecting public buildings, schools, and private businesses. So we were very careful over late summer and fall to be in communication among, you know, the school administrators and, you know, Mayor Hero and, you know, Jess and I.
So what about the second point about if there was a value, what value would you utilize, and what would that value be? As a
Jess, you can jump in, but I think we've tried to look at all these areas. Yeah, go ahead.
And I think it really depends on the individual settings and what we're seeing going on at that given time. You know, and being able to address those specific concerns as they present.
So you're saying there is no value that you would recommend for when masks should be on or when masks should be off? That it's going to be case by case basis for months and months and months, years, who knows? So I guess what I'm trying to do is, if we were to try to create a policy, having a value as a quantifier of when the mask would be on or whether the mask would be off would be, I think, a little bit more logical than, you know, doing it for just in case. I guess I'm trying to do it data driven, but it sounds like there is no value.
Try to help me on
positivity rate, in-school positivity rate, something of that nature as a value to actually say this is when mask would be on or this is when mask would be off.
Well, I think it's fluid. It's something that, you know, we've taken the approach we've taken where we want to have a consistent approach, a consistent message. If we then evolve into drilling down to, well, the clusters are strictly in group home settings and not in schools, do we peel off and have separate kind of approaches? I'm always open to looking at those kind of questions and data points, but unfortunately I can't say, you know, tonight that, you know, we're at that point where we have that kind of information. Now, we know when there are clusters in schools because Deb Ebert communicates with Jackie O'Brien, and then Jess and I find out. So, unfortunately, I just can't give you a hard and fast. But, Jess and I are always open into looking into, can we, separate these things out? But go ahead, yeah, somebody jump in.
Ms. Johnson, do you have a question?
I do, thank you. Two, actually. So we know that we have a very diverse community and that we have families that may contain immunocompromised members living in the household, be it a parent, be it a grandparent, be it a sibling. We had mentioned earlier that COVID seems to present in children more as a more mild case. But does that more mild case that a child might experience equate to if they were to transmit? Would the person that catches the virus also have a mild case? Or does that really, is that more based on the actual patient, for lack of a better word?
Yeah, I haven't seen that be the case. It's just strictly a kind of, they carry the virus, the children carry the virus, can then spread it, and then there's a certain dosage that someone's exposed to that then they start replicating the virus. So, again, milder symptoms in the kids, but they are carrying it and spread it to others, and then it all depends what the recipient has for an immune system or, a viral load that gets, shed to them and then off and running with their replication. So I think your point about immune compromise is the key one, is how much is the recipient, is their body going to then either fight this off to some extent or it's just going to run rapid.
Sure. And even if they were to transmit, whether or not that family member is immunocompromised, they may be an adult, but just because the child had a mild case doesn't mean that the adult would necessarily have a mild case. Because again, it's the recipient. And
I think that's correct.
Okay.
Because I think children generally have mild cases.
All right. Although they may, but they may not. So the second question that I had, and I think this is kind of along the lines of what Mr. Storrs was asking, in your professional opinion, is there a specific tipping point where or a metric that you're using currently that says, hey, this cluster is behaving this way, or the spread is behaving this way in this community, whether it be our school community or a community at large, that you would recommend staying with the mask, and then the spread or infection rate have to look like in order to say, I think we're comfortable now with removing masks?
So I can jump in and just say that those are close conversations that happen almost on a daily, weekly basis between our public health nurse and the school nurses, along with me being brought into situations and Dr. Quinn to review. Sure. So all clusters are different. There's moving factors that are very, very different in every situation, but those are something that we closely monitor. And it really comes down to case interviewing and tracing and really data collection in every one of those situations. We find that they're all very different and pretty unique.
I can appreciate that. Would you suggest that maybe seeing decreasing transmission rate for 3 weeks, could that be a good metric to use?
I mean, I don't necessarily have any issues with that.
Okay. Thank you. I appreciate that. That's all my questions for now.
Mr. Larson?
Thank you both for coming first. 6 or 9 months ago, I dug into some of the numbers locally, and back then, the cases seemed to fall into 2 categories. About half of the cases seemed to be 1 or 2 families that all caught COVID together, and then the other half would be individuals here and there. So I guess my first question is that still tend to be how it's going locally, that half of the cases are family groups and the other half are just individual cases here and there?
I think we're seeing a lot more widespread differences right now, and something that we have that's relatively new this year is pool testing. So pool testing can be identifying transmission and sources that we weren't that we didn't have the data on last year. So we're getting a lot more information from testing that we didn't have last year. But I don't think we're seeing any straight across the board, little family situations. We're seeing family situations. We're seeing clusters. We also don't, have the social distancing in place that we had last year. So we're seeing a lot more unique situations than we were last year at this time.
Okay, great. Okay, well, thank you for that.
But Mr. Larson, you're correct. We would see the data where it would be a couple of cases and they'd all have the same address. So therefore you could conclude it was the same household. But as Jess is saying, we're seeing a more widespread address for the new count. So,
And my other question, just there's 9 of us around this table that are going to be asked to come up with a policy based on medicine, and none of us are have medical backgrounds. So, it's fascinating when we end up in these situations. But the Commissioner of Education is basically taken over this decision for us, and he's basically dictated what will happen between now and the middle of January. They've also come out with a policy, for the lack of a better word, that if 80% of a school population was vaccinated, then the masks could come off. I know the Commonwealth is averaging just under 70% at this point with the adults. Obviously, there's a lot of students that will all need to get vaccinated over the next few months. I guess my question, and this is kind of a little bit of a follow-up to some of the other questions that have come out already, is with this 80% policy that the Commissioner and the Department of Education has come out with, is 80 enough? Are you comfortable if we say, there's 2,000 people in a building and 80% of them are properly vaccinated? Would you be comfortable with 2,000 people taking masks off?
yeah, I mean, it depends. There's a lot of moving targets on this thing, a lot of factors. You're looking at a population that, as you're pointing out, isn't even close to the numbers that they're referring to as far as percentages to get to that point. And secondly, what kind of waning is there of robust immune response that we see at 2 weeks and 4 weeks, which they show the data on, and then there's a weaning of the immunity. So, if you're talking 6 months after these 80% have had their, it's such a moving target because are all 80% of the youth group immunized at the same time so that they're all kind of, there's a wearing off effect by 6 months from then, but you don't have it that way. It's a rolling kind of immune kind of vaccination program so that some have more robust immunity than others. So there's a lot of moving targets on this to try to nail down that 80%. What does that mean? What time? How far out from the 80%? You understand?
Right. Oh, yeah. Trust me, I understand completely, and that's part of my concern is that if we were to get a build, according to the Department of Education and the Commissioner, if we were able to say to them that 80% of the population of a building has been vaccinated in some manner, to your point, the mask could come off. And I guess my concern is, I don't know what that number should be because I'm not a medical professional. And I guess I'm concerned that in that 80%, some of them are going to be just coming off their 2 weeks after they've been vaccinated, and some of them are going to be 9 months since they've been vaccinated. And I guess the question is, right now, if we said that we had a building that was 80%, as of yesterday, we could apply to get a waiver. And if I'm reading your body language correctly, and tell me if I'm wrong, I'm not sure you're completely comfortable with that.
It really comes down to monitoring the situation and monitoring the cases and seeing how it goes and, you know, how everybody's reacting to it.
Well, thank you again for coming. I appreciate your input.
Yeah, I wish we could be more specific, but it's just a moving target, and it's something new, and we're trying to adapt and do what's best for the kids, and bringing in the whole conversation, the socialization aspect that was brought up earlier. But at the end of the day, the masks are providing some benefit to preventing the spread. You know, the 80%, of course, is getting at the topic of herd immunity, and I think that's where we've heard, you know, 70, and then it went up to 80%. But that's a good general rule of, if you have that many people immunized, if someone is coughing and spraying these droplets and airborne particles and viruses, if people aren't wearing masks, then theoretically 70 to 80% of people will be protected. So then you're not going to have that string of spread to the next person and the next person. So it just isn't going to be like that as from at least with vaccinations rolling out, and then some people getting them now and some people later and some people had it a couple months ago, as you pointed out. So Jess and I are we're doing the best we can with working with Deb and Jackie and, you know, the mayor's administration, school administration, the state, and it's just trying to come up with the best, most consistent approach that we can right now. But Jess and I are open to anything you want to bring into the conversation. That, you know, we don't see any clusters in the school. Can we revisit this? We're always open to discussing that. So, and, you know, we don't want to do anything as an island, as a health department island. We want to be bringing the schools into that conversation.
Thank you.
Mr. Domenici?
Thank you. And like my colleagues, thank you for taking the time tonight. Just a couple of quick questions. Have you seen an uptick in breakthrough cases? And assuming if the answer is yes, because I suspect that might be the case, do you have an idea as to what percentage of those may be in school-age children?
I'm sorry, did you say breakthrough cases?
Yes, where people have tested
Okay.
positive after
Static.
having been vaccinated. Yes. And what percentage of those might be in the, you know, school-aged children?
I mean, I think we've been seeing less breakthrough cases in school-age children than we are seeing in the older population right now. You know, but it definitely is happening. I don't have the specific percentage. Those are numbers I can work on getting to you, and we can email them over to David once we pull them and run them. But again, the breakthrough cases on vaccinated children are still, you know,
Mr. Geddes?
Thank you, Mr. Chairman, and thank you both again. This has been fascinating and very helpful. I wish we had you in August when we had that first lengthy meeting about this. Just to I guess sum up some of the recent questions, going back to Mr. Storrs' original question. It sounds like there's no specific data point because every data point has so much context behind it that it by itself can't be a good indicator to make a decision one way or another because of all of that context. So to Mr. Larson's point, the daily cases per 100,000 might be alarming, but if it's because of significant in-home spread, that wouldn't necessarily be reason for us to return to masking or continue masking within the schools because of that context. But one of the, which is very helpful to know because I think we've all had kind of a data approach to it, to Mr. Storrs' point. So that's helpful to consider. But Ms. Horstman, one of the things that you mentioned was, in one of your answers there was pool testing. To can you speak to, can either of you speak to the benefits of pool testing, why more families should be participating in pool testing, and whether or not, admitting that there may be some additional context to the amount of students and educators that are in pool testing, how the participation in pool testing might help us to decide one way or another on whether or not masks are required in the schools.
So pool testing is an amazing resource that came on board, and I think we were all jumping for joy when we found out we were getting it. But the main benefit of pool testing is we're getting early detection in kids that we might not have ever known were carrying the disease. So it's really allowing us to get ahead of it and get those kids who are, asymptomatic at that point out of the school and stopping further transmission. So we're definitely grateful to see the pool testing. On the flip side of it, we're seeing more positives because we do have that early detection. So it is a benefit, and it's definitely helping to aid the situation from progressing.
Thank you so much.
Mr. Storrs?
I have two questions, if I may. First one's a little question. I'm not sure if you'll be able to answer it because I can't figure it out online, but we know that one of the states in our country that doesn't have the masking requirements, doesn't have regulations, seems to have the lowest numbers of COVID positivity. I'm trying to understand, how's that possible? Obviously, I'm talking very south from where we are.
Where's that?
That would be Florida. Florida.
Yeah, well, they had high rates initially, so folks who have immunity, so then their rates are going to go down again.
So you think they might be at herd?
I don't think they're at that point, but I think the theory there was to, have a combination of vaccination and those who have had the illness. And originally it was going to be fewer on the illness side and more on the vaccination side, but as time goes on and people have had the illness, then it's going to reverse. But as immunity wears off from vaccination, but a robust immune response from having the illness would persist.
Okay. All right.
I think those numbers were high in Florida originally, so I think that reflects now why they're down.
Okay. The follow-up question is actually more about our decision here. So as Mr. Geddes brought up, the pool testing is something that we didn't have last year. And to me, the pool testing is one of the best resources and reasons why I feel we could be heading towards the demasking, because it's reactionary, right? We're able to quickly react and isolate and deal with positivity. So as the numbers go down, it seems like because of pool testing, we have a new resource that we didn't have before. But in addition to that, we know that it appears, I'm sure you would agree with this as an expert, that when the students are closer, that is when things are more concerning. Except for during lunch. We know they can't catch it during lunch. Sorry. I know, sorry. I'm trying to be a little late. But the point being is, like, when they are close, when students are closer to each other, or anybody, that would obviously be a more opportune time to catch the disease. Is that fair?
Yeah, if someone's ill, sure.
Right. So would you support a policy at some point, obviously we're not until January, at the middle of January at the earliest, but if we get to a certain point, would you maybe be okay with support a policy where when they are congested, for example, going class to class or something of that nature, mask on, but when they're sitting in their seat, everybody facing forward, 3 feet apart or more, maybe take the mask off at that time, something of that nature, coupled with the pool testing?
Yeah, I mean, you're getting into mass gymnastics there, which maybe people are happy to do if, they don't see that as a burden if they're able to get those masks off. But, it's all for debate. Again, at the state level, we follow very closely what the state's doing, obviously, and They have experts at their level from Mass PH who are communicating with CDC. So we rely a lot on their information and their guidance. So again, we won't be making any decisions in isolation, right, Jess?
I really think DESI's probably going to extend that mask mandate out a little bit.
I totally agree with you. And again, thank you guys for being here tonight.
No, yeah, very good question. I appreciate all those thoughts and thank you.
So I'll
Thank you for having us.
I'm going to wrap it up
If
with
you
one
ever
more.
have any specific questions, feel free to reach out.
Well, I got one more question. I'm going to wrap it up with one more question because it's something that confuses me about the conversation tonight and about the issue in general. There's a tendency, and I think we've done it a little bit tonight, to kind of poo-poo the inconvenience that masks cause and kind of make it out like it's not that big of a deal or the downside to masks. And so my question is, when then do we come to a point where we can actually unmask? Our numbers are lower than they were a year ago, despite the fact we have pool testing and significantly increased testing. We've had 0 to very little hospitalizations of minors in the city. We've had vaccines for adults for a long time, for children to 18 for months, and now for children 5 to 11. And then you hear things about concerns about, well, people have had a vaccine a while ago and it'll be wearing off, and so how effective will it be? That makes me worry that in March we'll be saying, well, the first round of vaccines were a year ago, so we really need to get another round of vaccines in before we're unmasking kids. And next thing you know, it's been 2 years that the kids have been masked to go to school. And my big concern is that it's just going to be January 15th or February 1st, and it's going to be another reason why we should put it off for 2 months. And so when, masks are not, are just a simple inconvenience for students. I think this committee has shown that safety is important to it. We had the schools largely closed for a while, or half and half. We had a partial mask mandate voted before the state voted what it did. But that doesn't mean that masking in perpetuity is good for students. And I think we all understand that. But what I want to know is, when can we finally acknowledge that and move towards getting rid of these masks? Because I just hear delay, and that concerns me considerably.
Yeah, it's such a complex question and point you're bringing up. And I think the goal is to get rid of masks, okay? So that's clearly a very simple statement, but I think it has to be spoken. You're bringing in, kids who are immunocompromised, and what is the burden of a group of children wearing a mask so that you protect a child who's immunocompromised, or a teacher for that matter. So it's such a public health, group health kind of question you're bringing into this. And at what point can you say we're done with this because the risk is dropping and lower, so that there aren't a lot of people who are ill, there aren't a lot of people who are coughing and sneezing this, so that you're not putting an immunocompromised child at more risk, or the teacher. So I think that's where we're looking in the future, is at what point is the risk going to be dropping, so that the benefit of unmasking and having socialization benefit to the kids in general is outweighing the rare occurrence of a child being ill and coughing and ejecting these droplets and airborne particles. So I just unfortunately don't have a good answer for you, but believe me, we want to unmask. That is the goal, and I think it would be good in a lot of ways, but I think we have to keep the public health areas of this topic in mind for now.
All right, thank you very much for joining us. There, all set.
Thank you.
Mr. Sawyer, your superintendent's report.
Thank you, Chairman Withers. really tonight, I feel like we should extend their presentation into a discussion. I just wanted to make a couple points for your consideration. As I've said multiple times, first and foremost, I hope that the committee will continue a policy as you had in August that does not put teachers on the front line of policing who is vaccinated and who is not vaccinated. One of the major flaws of the state's approach with the 80% waiver is that to pursue that waiver would require that teachers be monitoring which students are vaccinated or not, because only vaccinated students can go without a mask. I can't say enough how much of a distraction from learning that would be, and how that would, in my opinion, poison the well in terms of the culture of the classroom to put teachers in that position. And so whatever we do as a district, when the time comes, I definitely hope that we won't go down that path. I think that the health department's presentations, which I want to take a moment to express my appreciation for them coming in this evening to join us. I had a couple important takeaways in listening to them. At the end there, I think it's really important that Dr. Quinn said that the goal is to eventually be unmasked. I think it is important that we are all honest with ourselves, that there is a cost to being masked as a district, that does not come without its detractions. And so, the sooner we can get, the better it'll be for everybody. But, we have to weigh that against the health concerns. And, both the state and our local health officials are telling us that in this moment, it is not safe to make that decision. And I am not, a health expert. That's not, my area of expertise. I can't speak to that. So I'm going to take their word for that. And the good news is that in terms of between now and January 15th, there's no choice in the matter. And I think I put a minor spin on what's already been said by a couple people tonight. If things don't change between now and January 15th, I think the state absolutely will extend the mask mandate. I think there's no reason to believe that that won't happen. Because as we heard, conditions like we're experiencing now, from the health officials' perspective, isn't safe enough to have masking. They told us that in schools that don't have masking, they're seeing much greater spread. I mean, that's not an important comp. I don't know what is. So I think we can anticipate that will continue, and so that's good. But what we're really trying to imagine is that there is going to be a point, and it may not be on January 15th, but there's going to be a day in which the state takes away the requirement, and then what we're left with is our policies, and we have a policy in place. And the question is, what can we do at that point? And I think the point is that we can consider leaving it the way it is, or we can think of something, take steps to make it so that we can get to that goal of being unmasked a little bit quicker than that policy would get us there. And then perhaps there are measures that we can put in place, as have been discussed, to help us decide when it's safe to make that decision. So those are my perspectives on this issue, and I certainly understand that the committee has difficult decisions to make in terms of trying to find that balance between keeping our students safe, which is obviously goal number one, but also getting us back to normal so that we can do our best work.
So what we're really talking about is what we're going to do when the state lifts their mandate. And that could be, it's not going to be before January 15th. Maybe it's January 15th, maybe it's February 1st, maybe it's February 20th, maybe it's after February vacation. But at some point, hopefully, the state's going to lift their mandate. I expect they will. And so we need to decide what we're going to do as a district when that happens. So at this point, I'll entertain a motion that the Attleboro school policy, when the mandate's lifted by the state, will be to encourage all non-vaccinated students and visitors to the school buildings to wear a mask.
Second.
All right, so we have a second. Discussion. Mr. Domenici.
Forgive me, but what exactly does that mean? Are we saying we recommend you wear a mask if you're unvaccinated?
Yes.
What about for vaccinated? Are we saying we're removing the requirement?
We're removing the requirement for everyone. We're recommending, we're having a public recommendation that if you're not vaccinated, like if you go to a store and it says if you're not vaccinated, please wear a mask. we're suggesting, recommending to those who are unvaccinated that they wear a mask. Obviously, anyone's entitled to wear a mask in the building, whether they're vaccinated or not, teacher, visitor, student. But the mandate, when the state mandate goes away, the City of Attleboro Public Schools mandate would go away. Mr. Storrs?
Thank you, Mr. Chairman. Whatever it was, 9 months, 10 months ago, we couldn't even go into a store without wearing a mask, right? So the state had some value, some quantifier that they were using to make that decision. And then it got to a certain point, and they said that wasn't required anymore. Our city and the DESE, they made their decisions for in the schools, in the state, in the city buildings, and things of that nature. But I go into the supermarket right now, I'm not wearing a mask. I walk into a restaurant right now, I'm not wearing a mask. And I know everybody at this table is the same way, because I've seen you guys out there. So I know you guys aren't wearing masks when you go into your restaurants and supermarkets and everywhere else. The point is, they use data in some way to get there. Come January or February or March or whenever that will be, the state DESE is going to come up with a reason, based on data, to do away with the mask requirement within the schools. As it was indicated by our experts, the state is using experts. So I kind of feel that once we get to that point, the experts for the state are going to have reason to feel that the mask can go away. I think we should rely on that when the time comes. This policy effectively does that without having to wait. I'm okay with waiting because right now the data isn't perfect. We don't know what it's going to be in January. It'll probably be extended. It could be February. Who knows? But this policy kind of covers us at the same time. So I can support this, but I could also wait.
The purpose of the motion would be that the state has shown that it will extend if it feels it needs to extend. It's extended it twice now. But when the state has decided it no longer needs to extend it, then we will follow the state and not mandate it.
Right. And my point is that I believe that when they make that decision, it will be based on the experts using data to make that decision.
Mr. Geddes?
Thank you, Mr. Chairman. I think I agree with what Superintendent Sawyer said and what the health department said, that ultimately the goal is to unmask, but to borrow from driver's ed when safe and proper to do so. So I think simply voting to say that when the state lifts its requirement, then we're going to revert to our policy that feels more binding to me than if we were to. I guess I think a more appropriate motion would be related to whether or not we were going to extend the requirement beyond January 15th. One of the things that was said tonight, I believe it was by Ms. Horstman, was that eventually we would like to see the schools get to a point where it's safe to not require masks. But at this point, it should absolutely be at least through January 15th, and it's probably more prudent, and I'm summarizing, but it's probably more prudent to go at least through February vacation. Looking ahead, we do have a meeting scheduled for Monday, February 28th. So before you made your motion, I was considering making a motion to extend the requirement through Friday, March 4th, so that we could then revisit at the end of February or even possibly before February vacation to decide whether it would need to be extended beyond that, so that we're not committing to a full year of masking. We're continuing, like we heard a lot tonight, to look at the data, look at the context of that data, and make a good decision at that particular time.
Mr. Larson and Mr. Hill?
I'm really hoping that we don't spend the next 4 hours discussing this, just as an aside. And I think we need to realize and be realistic with ourselves. The state is not going to come out on the 12th of January and say, nobody needs to wear a mask in schools anymore, period.
Right.
There's going to be a paragraph that comes after that. I think this motion it's good to have it in place. The state is going to change what it wants to do between now and the 15th, maybe a few times. This gives us some place to start. I think we're going to be having this discussion in January again. I'm hoping we're not having it in March, but I think we're going to have it a few times in front of us. So I'm hoping that we tonight don't get bogged down in a lot of vocabulary and a lot of dates and a lot of numbers, because in my humble opinion, there is no way the state on the 15th of January is simply going to say no more masks in the school across the state, period. There are going to be conditions that come with that, or there's going to be an extension. So I think 4 hours together, I'd like to just kind of let that part soak in, and let's continue to have the conversation over the next few months and wait and see where the state goes with this.
Thank you. Mr. Hill?
Yeah, I just want to say I really appreciated the presentation and really took Dr. Quinn and Ms. Horseman at their word when they said that they really want students to be unmasked. And so I think any discussion about the future would be, it would be very prudent to have them be part of the discussion and not have something be, you know, already decided. And our goals are the same. So I think, you know, I envision them providing us with excellent guidance like they did tonight that was very nuanced, and it was not just a broad brush. And so I think, you know, while I understand exactly what, you know, what you're going for, and I think we all want that unmasked thing, for me it would make sense to just kind of revisit the issue with their guidance.
Mr. Storrs?
Thank you, Mr. Chairman. To me, the idea of extending the mask mandate in November out to March without knowing what the date is, without knowing what the state's going to make their decision, that, to me, that's absolutely crazy to be that far out. We're talking 5 months. That's crazy to me. I totally agree with everybody that we're going to get to January. I'd put money on it that it's going to get extended. But the thing is this, if we do go with the chairman's motion, we know that this could be revisited, right? We know that if we get there and somehow or another the state says, yes, no more masks, we don't need the masks anymore, but the data doesn't match what we want and our experts are telling us, no, we shouldn't be doing that, anybody can talk to the chairperson, get this back on the agenda, and we can bring it back up for discussion at that time. But having this in place allows us to plan for when the state's experts tell them it's okay to remove the mask. So I do support the motion in that regard, and I know that if we get there and the numbers don't match or there's some other concerns, we're being told by the experts there's other things to think about, I know somebody out of the 9 is going to bring this up again. So I don't have concerns in that regard.
Yeah, I'd add to that is that we did that last year. We had a special meeting that was called in December of last year when members felt that the situation on the ground warranted it, and we weren't meeting again. And that, I believe, was a meeting where we closed the schools after Christmas break for a couple of weeks. So I think your point is well taken. Anyone else? Mr. Geddes?
Thank you, Mr. Chairman. Mr. Storrs, I agree that voting in November to discuss what should happen in February or even after January 15th is a troubled premise to begin with, and I expressed that at our last meeting as to whether or not we should make a decision.
You did.
I guess, that was when we talked about bringing it up at this meeting. I said that my largest concern of discussing it tonight would be that we don't know what the data points, what the relevant information that we would need to make that decision will be on January 15th when we're sitting at November 15th. I guess my clarifying question, when we voted on this policy back in August, we said that we would discuss it at our November 1st meeting. I do not believe that we set an expiration for the policy of November 1st. So my understanding is that when the state's mandate goes away, regardless of when that is, then policy EBCFA would automatically go into effect. So I guess my question would be, isn't that already, if that's already the case, then why would we need to make that vote tonight?
Sure, so I think you're correct in that the motion, if we take no action tonight and the state gets rid of its mandate and we take no action before the mandate expires, the policy we enacted will go into place. It did not have a sunset provision. The reason I, as the moving party, made the motion I did is because, in my opinion, when the state removes the mandate that all students wear masks, they will have done so based on the research and the data, and at that point, the provisions in policy EBCFA requiring face masks for middle school and elementary school students would be too stringent, and I believe at that point we would be in a place where we would not need to require masks. So you're correct that the policy would go into effect. The purpose of the motion is so that it wouldn't, so that it would be changed.
So, I'm sorry, say that last statement again.
You're correct. If we take no action, our current policy would go into effect, but the purpose of the motion is so that would change. Is so that we would have a new policy not requiring masks. But if we do nothing, you're right. We don't have to vote to reenact the policy that's in place.
Okay, so there would still be wiggle room within your motion that if so your motion is not precluding any future vote to continue to require masks beyond the state's mandate. So, for example, if they say we're stretching from January 15th to February 1st, the committee could still, someone on the committee could still make a motion and we could still deliberate and vote on extending beyond that February 1st.
Correct. We could do that at a regular meeting or a specially called meeting. I mean, we could change any policy, but yes, this would just be the policy that would go into effect, if it was not changed. So the default would be we go along with the state. But we could change it, yeah. Mr. Storrs?
It's an important point. Effectively, your policy negates policy EBCFA. I don't know if that needs to be coupled into the motion that was made, if it needs to be amended. I mean, it's obvious that that's the case, but I figured I'd raise it.
I think we're all right.
Okay.
Yeah.
I just wanted to put it out there.
Thank you for that clarification, Mr. Storrs.
Thank you.
Mr. Larson?
And I think part of the motion that we made a long time ago was that we had to revisit it in 3 months. And that's what we're doing. So by the nature of what we all decided on that night, this is the discussion that we all agreed to have. And if this motion goes forward, it would be that this is what is now in place.
Right, and when we revisit it the next time, it would be to revisit this
This.
policy.
Correct.
Any further discussion? Mr. Domenici?
I guess I have a qualifying question similar to Mr. Storrs. Would this motion be more about, as head of the policy, revise the policy, and then it would have to go through a formal, or we're just saying this is gonna,
This would be the form.
this will overrule?
Yeah.
Okay.
So the EBCFA would now become the new wording. Is that a fair statement?
Okay.
Yeah, I mean, there's more to that policy than that provision, but that provision would replace the other provisions. In the larger policy, they would still be there.
And this is the vote that would put that into effect. So we wouldn't have to go rewrite the policy, bring it back again.
Right.
This would make that change.
Right. My comments for me, like I struggle with this because, you know, I've certainly erred on the side of caution. I have concerns about unmasked, untested, unvaccinated kids potentially spreading COVID in our schools. But since this all started, even back from when we were trying to figure out how to open schools, I've always been one to say we should be following state's guidance. And that's where I get, it troubles me here because I get frustrated that we have to make these decisions. We are not medical professionals. We are asking medical professionals for opinions, and yes, we have to make policy, and I get that. But, the state punted this for so long. Now the state has stepped up and kind of overruled everything. I don't know if when the state comes back and makes a decision, if that overrules any local rules to begin with. We don't know that. I also know that we've shown capacity at times to go against the state's guidance when we felt the need was there or not there in Attleboro. There was a point where the state required us to go full remote because of numbers, but we ultimately voted differently because we felt that those numbers weren't a reflection of what was going on in the schools. So I can see some merit to this motion for a couple of reasons. One, we'll continue to follow the state's guidance. We seem to have confidence, I do too, that guidance is going to extend. We also have the ability as a body. I do agree with Mr. Hill. We should be bringing in our health professionals when we get closer to maybe having to revisit, and nothing says that we can't. So I guess where I fall is I guess in the short term I can support this, knowing that we have the ability as a body to make a change if we feel necessary to do so.
Okay. Mr. Larson?
I'm all set.
Mr. Gaddis? Mr. Gaddis?
Sorry, I thought you said Mr. Larson. While I do recognize the opportunity to revisit if necessary, and I do agree that I hope the health department will come and participate in future meetings as needed. I don't think I can support a motion that would kind of that would take us from one extreme to another. From a complete mandate to everything's optional with no in between is a bit of a struggle for me. I know that Mr. Larson, I fully agree that there will be any context to state guidance and state policies that come forward, or any potential extensions. But for us to say, even to Mr. Storrs' point earlier, we don't know what we don't know, and we don't know what January 15th will be like. We don't know what anything will be like when the state does remove its mandate. So for us, I have severe concerns with us saying whenever that is, whatever that context is, we're no longer going to be requiring masking of any kind, aside from having to revisit and revamp an entire policy again like we did in August. That's very concerning for me. So unless someone can persuade me otherwise, I don't feel comfortable supporting this right now.
Ms. Sawyer?
Thank you. I agree with Mr. Getty's sentiments. I mean, we're just about to enter cold and flu season, let alone COVID on top of it. And I just feel like it's too soon to be changing the policy. We should keep what's in place now and then revisit it in 3 months, just like we did 3 months ago. That's it. Thank you.
So, I mean, I guess since it's my motion, I guess my only rebuttal to that would be that we're not saying that we'll remove the mandate in January. We're saying that if the state says it's safe and that we don't have to have a mask mandate, then we'll remove it. But that being said, I understand it. I do take your point. Thank you. Mr. Storrs?
Just one last thing on this, and I think it's already been said, but just to say it again, and to Mr. Domenici's point, the state is not going to remove the masks for no reason, right? They're going to do it based on data. If they extend it, it's going to be based on data. If they remove it, it's going to be based on data. I know they're using experts. I'm sure our experts would agree that the state has experts that are helping them to make this decision. If they get to the point where they feel that the entire state is at that point, I have to believe that that's reasonable, that it's based on data, it's based on experts. If for any reason anybody in this room, elected person in this room, or the administration, or health experts feel that the state is incorrect when it comes to Attleboro, I know somebody will bring it back to this table and we'll be able to discuss it and act. So I feel, just like Mr. Domenici just said, this is a good policy because I don't believe the state would act for no reason. I believe it'll be based on data, and that's what I always try to make my decisions on.
Ms. Porto?
I would like to sentiment yours as well. I feel I could support this based on the data and everything that is brought to us, so.
Thank you. Ms. Johnson?
So, Mr. Sawyer stated that one of the most important things that we should consider with our policy here is that we don't want to put teachers in the position where they are policing students. I'm uncomfortable with the wording of encouraging non-vaccinated to wear. At this time, again, as the health department said, and I've said this before in past meetings, this is a very fluid situation. I'm more comfortable with keeping the current policy. I am confident that A, that this will be extended, and B, when it's rescinded, that we're going to have enough of a runway that if needed, we can pull a special meeting together to say, let's rescind this, or let's modify the policy EBCFA. So at this time, I'm more comfortable with keeping the current policy in place for that reason.
Okay. I think that will close discussion, so I'll take a roll. Mr. Domenici?
Yes.
Ms. Porto?
Yes.
Mr. Storrs?
Yes.
Mr. Larson?
Yes.
Mr. Withers, yes. Ms. Johnson?
No.
Mr. Hill?
No.
Ms. Sawyer?
No.
Mr. Geddes?
No.
5-4. Motion passes.
All right. Thank you, everyone, and thank you again to everyone on the committee for the discussion. This is, as we've seen, it's a loaded topic nationally, locally here, and I know everyone has strong feelings, but I appreciate that despite those strong feelings, we've kept it professional despite disagreements. So, thank you to everyone for that. Mr. Sawyer?
I want to thank the committee for the clarity that you provided, and I want to assure everyone that the school department will continue to work with the health department. The lines of communication are strong. We continue to work together for everyone's collective safety, and that as we approach the 15th and as the state provides us some indication of where they're going, we would certainly be discussing local conditions with the health department to make sure that what we've decided here tonight is a prudent thing to do, and we'll be reporting to the committee moving forward as things unfold.
Thank you. Mr. Geddes, did you have a question?
No, I just wanted to, again, thank the health department for participating, and just wanted to, Mr. Sawyer stole my thunder. Thank you to the health department for their collaboration with our nurses and our administration. We really do appreciate, and we know all of the work that goes on behind the scenes for contact tracing, for pool testing, for assessing and providing all of that context. We really do appreciate it. And we look forward to seeing you again sometime soon. Thank you.
Thank you.
Mr. Domenici?
Yeah, on top of that, obviously, we're all thankful for the health department tonight, so I don't want to continue to state those things, but I do think we should at least extend the invitation, if at least to our January meeting, to have the health department come in as we get closer and provide some more guidance, so that we come to the best possible decisions that we can. If we can maybe procure that, I'd almost say December 6th if we knew. I wish we had another meeting in December, but can we at least agree with getting our esteemed guests to come back, at least in our January meeting?
The only caveat I would make to that is if
Obviously, if
the
the state
punts
extends-
everything to February, then I don't want to drag them back here for January 6th, but if it's, or whatever the date is in January, but if it's January 15th, then yes, I think it's well taken, or if it's early February even, I think this should, we'll want to have them back before, whether we make a new decision or not, but before a new policy went into effect, we'll have them back here.
It's good to have, have a good understanding of what they're seeing, is my point. And by then, we're probably going to want to know after the holidays where we are.
Yep.
So if we
Agreed.
don't think that having them here in person on that meeting, it would be at least prudent to have that information handy for that discussion. Because like I said, I do suspect we will be revisiting this policy, probably after the holidays at some point. We may have to.
All right. Our other agenda item this evening is Ms. Regan has a update on our vaccination clinics.
Thank you. This past Saturday, we hosted COVID vaccine clinic with Manic Community Health Service, Manic Community Health Center. We offered vaccine to children ages 5 and up, and we had about over 150 individuals that attended the clinic. They were also able to receive the booster if that was what they needed, and students and anyone who received the vaccine for the first time will also be coming to the clinic that's scheduled for December 11th so that they can receive their second dose. This clinic would not have been possible without the support and expert planning and coordination from Manit, as well as support from the Attleboro Fire Department. Also, I do want to give a special thank you to Deb Ebert and Chris Cerrone for helping to plan everything behind the scenes, and then also to Miss Angelovsky, who's our family engagement specialist, who coordinated all of the student volunteers. So we had many student volunteers that came. They helped to pass out toys to some of the students after they received their vaccine, and then also we're working at the registration table, so it was a nice opportunity for them as well.
Thank you.
That concludes my report.
All right. Thank you, Superintendent Sawyer. Next, we have minutes from our November 1st, 2021 meeting. Minutes were circulated with your materials. Do we have a motion to approve?
So moved.
Second.
Any discussion or edits? Ms. Sawyer?
Yes.
Mr. Hill?
Yes.
Ms. Johnson?
Yes.
Mr. Withers, yes. Mr. Larson?
Yes.
Mr. Storrs?
Yes.
Ms. Porto?
Yes.
Mr. Domenici?
Yes.
Mr. Geddes?
Yes.
Thank you. Consent agenda tonight, just 2 items. Motion to accept a payment in the amount of $6 from Bay State Textiles to Hill Roberts, and a motion to accept a donation in the amount of $44.15 to be accepted towards a prior year lunch balance of a student in need.
So moved.
Second.
Any discussion? Mr. Geddes?
Yes.
Mr. Domenici?
Yes.
Ms. Porto?
Yes.
Mr. Storrs?
Yes.
Mr. Larson?
Yes.
Mr. Withers, yes. Ms. Johnson?
Yes.
Mr. Hill?
Yes.
Ms. Sawyer?
Yes.
Subcommittee meetings. Ms. Johnson, Teaching and Learning?
Thank you, Mr. Chairman. This is regarding the Teaching and Learning Subcommittee meeting of October 5th. This meeting of the subcommittee was the first after the start of the current school year, and it began with a review of the return to school and reflection on the year to date as students return to the building full-time. We were happy to have Ms. DePalma join us to share her feedback in her new role as the Director of Social and Emotional Learning. Both Ms. Regan and Ms. DePalma reported they had been visiting all the schools. It was acknowledged there was a common theme of nervousness amongst the students and staff as they returned to the building full-time during the pandemic. Ms. DePalma discussed the supports being put in place for the district to take a proactive approach to addressing the specific issue. She also shared with us some of the plans she and her team are putting together so that the unique needs of each building are addressed and that they have what they need to be successful. This includes new approaches at communications with our families and our community, and a welcome center in the new building to support incoming and existing families in our district. Ms. Regan shared that she had visited all the schools and the implementation of and the opening had been a general success. And we'd like to thank the administration, teachers, staff, students, and families for their hard work and contributions to the successful start of the school year under these challenging conditions. Ms. Regan also provided the committee updates on the new programs that have been rolled out in recent history. And as a reminder to the committee, this includes the I2 learning, which is our project-based learning curriculum that we're using in grades 5 and 6. ALEX, which is actually a new supplemental math program being used at the middle schools to help identify and close gaps for students. And this was a program the district applied for and was granted by DESE. The CCC, Center for Collaborative Classroom, which is our K through 2 ELA program. And our Open SciEd, which is the science program in grades 6 through 8 that we began rolling out in phases last year. This program helps apply science to real-world scenarios and allows students to continue to explore the science topics throughout their school day in their different classes. Something that is important to note at this point is that these programs that are part of our curriculum that hadn't been newly rolled out are due in part to the hard work the district has done to find these grant opportunities. And programs like these are helping keep our district competitive with other districts in the state that already have the budget to provide these courses regularly. So thank you to the administration, Ms. Regan, and all that were involved in finding these grant opportunities. Any questions or comments at this point? Okay, Mr. Chairman, that concludes my report.
Thank you, Ms. Johnson. Next, Policy and Personnel, Mr. Storrs.
Thank you, Mr. Chairman. Policy and Personnel Subcommittee met on November 8th. The following motions were brought forth unanimously. The first motion is to note the review date for our policy ADF, Health and Wellness Policy. This policy differs mostly, majority, from the mass policy as it is specific to what we are doing in Attleboro. So there are no changes. I'll take this one on its own. So all of these policies were voted out unanimously and they're going right up for discussion. So is there any discussion regarding noting the review date for policy ADF, Health and Wellness Policy? Seeing none. Mr. Domenici?
Yes.
Ms. Porto?
Yes.
Mr. Storrs, yes. Mr. Geddes?
Yes.
Mr. Larson?
Yes.
Mr. Withers?
Yes.
Ms. Johnson?
Yes.
Mr. Hill?
Yes.
And Ms. Sawyer?
Yes.
All right, passes unanimous. Next, all of these policies, they align with MASC, and we are noting the review date, recommending to note the review date. Policy BA, School Committee Operational Goals. BAA, Evaluation of School Committee Operational Procedures. BBBA/BBBB, School Committee Member Qualifications and Oath of Office. BBBC, School Committee Member Resignation. BCA, School Committee Member Ethics. BDD, School Committee Superintendent Relationship. BDF, Advisory Committee of the School Committee. BE, School Committee Meetings. BEDA, Notification of School Committee Meetings. BEDD, Rules of Order. BEDF, Voting Method. BG, Policy Development. BGB, Policy Adoption. BGC, Policy Revision and Review. BGE, Policy Dissemination. BGF, Suspension of Policies. And BK, School Committee Memberships. If anybody would like me to break out any of them, please let me know. Seeing none. Ms. Sawyer?
Yes.
Mr. Hill?
Yes.
Ms. Johnson?
Yes.
Mr. Withers?
Yes.
Mr. Larson?
Yes.
Mr. Geddes?
Yes.
Mr. Storrs, yes. Ms. Porter?
Yes.
And Mr. Domenici?
Yes.
All right, all those pass. Note the review date. There was a motion to note the review date of the following policies. They slightly differ from MASC as they specifically reference our city school district regulations and titles. Policy BB, School Committee Legal Status. It reflects the number of Attleboro School Committee members. The administration recommends noting the review date. BBA, School Committee Power and Duties, slightly differs to reflect the specific titles. BBAA, School Committee Member Authority. We want to add the cross-reference of KE, Public Complaints. BBBE, Unexpired Term Fulfillment. It's specific to our charter. BDA, School Committee Organizational Meeting. It's our Attleboro Protocol. BDB, School Committee Officers. It reflects our titles. BDC, Appointed Committee Officials. It's to our protocols. BDG, School Attorney. It follows our protocols. BEC, Executive Sessions. We want to add the cross-reference of KEB to align with MASC. BEDB, Agenda. We want to change the title to Agenda Format to align with MASC. And BEDB-E1, Agenda Format. Again, that's per our protocol. Would anybody like me to break any of those out individually? Seeing none. Mr. Domenici?
Yes.
Ms. Porto?
Yes.
Mr. Storrs, yes. Mr. Geddes?
Yes.
Mr. Larson?
Yes.
Mr. Withers?
Yes.
Ms. Johnson?
Yes.
Mr. Hill?
Yes.
And Ms. Sawyer?
Yes.
That passes unanimously. So there were some minor edits made to the bullying prevention and intervention plan per our policy, per state law. And we need to review that on a bi-yearly basis. I would ask the administration just to give us a summary of those edits, please.
Sure. We reviewed all the links that were included in the plan to make sure that they were functional, updated, all of the curriculum documents that were linked in there as well, and then cross-checked it with the state's current bullying prevention and intervention checklist, and to make sure that the content matched.
And the committee did review everything to ensure that we are 100% aligned with the state law and what's required of our bullying intervention, prevention intervention plan. And again, this is something that was developed back in 2010, and it's undergone some minor changes over the years in the administration. That was something that they've been working on and maintaining, and they've done a great job with that, so thank you. Any discussion regarding the minor edits to the bullying prevention and intervention plan that was provided? Seeing none. Ms. Sawyer?
Yes.
Mr. Hill?
Yes.
Ms. Johnson?
Yes.
Mr. Withers?
Yes.
Mr. Larson?
Yes.
Mr. Geddes?
Yes.
Mr. Storrs, yes. Ms. Porto?
Yes.
And Mr. Domenici?
Yes.
Passes unanimous. Next, we have a motion to approve some changes. It's pretty minor overall to the handbook regarding the Chromebook language. So again, if I could ask the administration to summarize, please.
Sure, Mr. Storrs. So the district just modified some of their language based upon some guidance we received from DESE stating that we will recover accidental damage for one Chromebook, and then a loaner Chromebook will be provided to the student while that Chromebook is being repaired. If there are subsequent damages to any of the Chromebooks after that, then the charges will be applied to the student, and it'll be part of their obligation moving forward. And so the other update that we added was information specific to charging cables. So we've updated the language on our website to say that if a student loses a charging cable, or if it is no longer working properly, they can purchase their own through the information that's provided on our website.
Thank you. Are there any questions or discussion regarding the changes to the handbook? Seeing none. Mr. Domenici?
Yes.
Mr. Storrs, yes. Mr. Geddes?
Yes.
Mr. Larson?
Yes.
Mr. Withers?
Yes.
Ms. Johnson?
Yes.
Mr. Hill?
Yes.
And Mr. Sawyer?
Yes.
Ms. Sawyer, sorry. Next, we have a motion to approve a new job description for a licensed practical nurse. The job description was provided. Are there any questions or discussion regarding this job description? Seeing none. Ms. Sawyer?
Yes.
Mr. Hill?
Yes.
Ms. Johnson?
Yes.
Mr. Withers?
Yes.
Mr. Larson?
Yes.
Mr. Geddes?
Yes.
Mr. Storrs, yes. Ms. Porto?
Yes.
And Mr. Domenici?
Yes.
Thank you. And last, we have a motion to approve some minor edits to the Family Support Specialist job description. And again, I'll ask the administration to summarize.
Thank you, Mr. Storrs. So the duties were expanded, namely under the qualifications. We've added that this person should have experience working with students and families who have social, emotional, or behavioral needs. The person also is going to be reporting to the Director of Social Emotional Learning as well as the principals. And also in the job goal, we also included that this person will be working with students who have behavioral needs, at risk, have truancy or attendance concerns, and then anything that would further impact the student's success in school.
Thank you. Is there any questions or discussion regarding the edits to the Family Support Specialist job description? Seeing none. Mr. Domenici?
Yes.
Ms. Porto?
Yes.
Mr. Storrs, yes. Mr. Geddes?
Yes.
Mr. Larson?
Yes.
Mr. Withers?
Yes.
Ms. Johnson?
Yes.
Mr. Hill?
Yes.
And Ms. Sawyer?
Yes.
All right. And lastly, there was some discussion that we had regarding the masking policy, which we've already gone through today, so no reason to go into it further. But in addition, we did have a little bit of a discussion regarding vaccinations and whether or not the state would ever put it on us to require a policy in that regard. I think it was safe to say that the committee's hope is that the state would never put that on us, as there's a big difference between something like a mask and something like a vaccine. So, and that, Mr. Chairman, concludes my report.
Thank you, Mr. Storrs. Next, we have Finance and Budget. Mr. Larson?
Thank you. The Finance and Budget Subcommittee met November 10th. We have one motion to come forward to the full committee. Mr. Furtado took us through the monthly budget reports. At this point in the year, we're still in pretty good shape. We do have one concern with some McKinney-Vento homeless transportation that could potentially be an issue. So we're going to continue to monitor that. Other than that, the budget is performing well. We had an MSBA update and just a few highlights from that. The building next door has now been hooked up to its own utilities, so it's no longer off temporary power, which is a great milestone. They're hoping that in early December it'll be all closed up, so the folks that are working on the school really appreciate that because it's going to get a little colder. They'll be able to put the heat on and actually have it work. There is a tour that is being planned for the middle of December for municipality, elected officials. There is a concern that they're monitoring about the furniture costs in the new school. As everybody realizes, if you've tried to buy a couch lately, they're hard to get and they're a little on the expensive side, with a lot of other things. So up until this point, we've been very, very fortunate from a cost control point of view on the building next door. And it sounds like there are some things to mitigate this, but it is a concern at this point that we'll continue to monitor as the project goes forward. The one motion to bring forward to the full committee is that we recommend, we'd like to entertain a motion to send to the municipal council for approval of payment to prior year invoices in the amount of $5,544.98 as defined in the memorandum from the finance director to Mayor Hero on October 28th.
So move.
Second.
Is there any discussion? I believe you're all given the backup information and all this, so. Okay, I have to have a roll call vote. Ms. Johnson?
Yes.
Mr. Geddes? Mr. Geddes?
Yes.
Thank
sorry.
you.
I don't need it.
Aye. Mr. Withers?
Yes.
Mr. Larson, yes. Mr. Storrs?
Yes.
Ms. Porto?
Yes.
Mr. Domenici?
Yes.
Mr. Hill?
Yes.
Ms. Sawyer?
Yes.
Motion passes. That is the extent of my report. Thank you.
Thank you, Mr. Larson. That concludes our subcommittee reports tonight. Next, we have open forum. If there's anyone who would like to address the committee at open forum, please come forward and state your name and address.
Elaine Marine, 500 Mendon Road.
Thank you.
It's late night, everybody's tired. I'm gonna make this quick. And again, I thank you all because I believe, even though I don't agree with you all, I believe everybody has good intentions in their heart. And I know the weight of your decision regarding the mask. I appreciate all of that, the fear and the caution and your concern for the immunocompromised. But I want you to remember this. We have to know that the immune compromised don't live in a bubble. They go out into the marketplace. They go out in public. Exposure to them can happen at any time. And I don't know, and I wonder why, natural immunity is not entering into the conversation. There have been many studies that have shown it's actually superior. Naturally immune people don't shed. There's been people that have had SARS. I don't remember when that was really big, in the 80s or something. They still have their active T cells that have kept them through this whole thing. So I'm not quite sure why that hasn't gotten a discussion yet, and I just encourage you to maybe bring it up. Thank you.
Thank you.
all.
Is there anyone else who would like to address the committee at open forum? Please come forward and state your name and address.
Well, my name's Anthony Marine. and I'm just going to be brief also, but just a couple things about the mask that I haven't heard is also some the kids, they touch their face and then they they use the same mask over and over. So those are some additional things you might want to consider. They touch your face and they spread it that way. Another thing also, just to briefly about the vaccines, just to state again that there is a lot of rebuttal on this. I'm not a doctor. I'm a program analyst. I just deal with facts. And there's top doctors that are being censored that even, these are international doctors that have been involved with this. These aren't slouches. And so I just want to say that there is rebuttal. Even from, let's look at Dr. Fauci. First, he was against the mask wholeheartedly, and then it was a flip-flop on that. He even said at the beginning that if it makes you feel fine, good, go ahead and wear them, but it's not going to do any good. Then he said about the vaccine, you don't have to worry about anybody else that's not vaccinated because you have the vaccine, you're fully protected. A few months later, it's completely turned around. So I know you got to go with the state. Now, also one thing about the state, and I appreciate, I'm sure everybody has great intentions, and we're getting from the Joe Biden also about, we're drilling into, what does it say? If you just say it enough times, people will believe it. So it's coming from the top. I just want to say too that there is rebuttal out there, and we just wanted to say that. I lost my train of thought now, but I'm not a speaker. But I do, I'm a fat guy, and I do get into. So it's a lot of, and I know we're all trying to do the best we can with this, and like I said, I'm not a health person either, but it is out there also. And another point that the chairman made: when is this going to end? Now we're almost getting conditioned. Okay, there's a big flu outbreak. Hey, mask worked before. Let's do that. Let's make sure everybody gets. Where's the next step? Are we going to, when we go to vote, are we going to need proof that we've been vaccinated? This is a slippery slope. Just all these things just come into mind right now. All right, I'll leave it at that. It's been a late night. Thank you.
Thank you.
Thank you.
Anyone else who would like to come forward and address the committee?
Hi, my name is Victoria Chipman. I live at 880 West Street. And I had a question for the four of you that didn't want to vote on,
Ma'am, I'm sorry.
address.
Yeah, this isn't a
individual
back and
people.
forth. This is where you address concerns or
Is there
comments.
ever a point when we can address people back and forth? Because
You can reach out to any school committee member or administration member directly or
I
contact
emailed
us.
all of you and I only got a response from 2 of you last week. So here's my question. The 4 of you are okay to accept the state's recommendations on masking everybody no matter what. But if they one day decided on January 15th, hypothetically, that they're going to remove the mask mandate, all of a sudden you guys don't trust them enough to go with it? Does that make sense? Does it? It's a yes or no.
Well, it's not, again, this isn't where we can't respond. That's not what open forum is, but we certainly hear your question.
Okay, so you want my email address? You can email me your answer. I'm just wondering, because it's getting tiring that there's always 4 people that want to just keep going down the same path. And I'm wondering when we're going to wake up and say, hey, what's the point? You brought up a great point about Florida. No mask mandates. They've been open. They've been fine.
Mr. Chairman, I'm sorry, but the mask is not covering neither the face nor the mouth.
It hasn't been the whole time, so you've been breathing the same air as me. Okay?
Ma'am, please finish your thought, please. If you can pull up your mask more, please. Thank you.
Eventually, we're going to come out of this, or we're not, right? One way or another. We're either going to do this for the rest of our lives because nobody wants to just stand up and say, let's try something different. You don't have any data on a different
Ma'am,
idea.
can you please pull up your mask? This is televised. Again, as I told you before, it's a mandate. We have no control over it. Please, thank you.
We do have control. You guys are just choosing to not have any control. You're choosing to do it. Bottom line, it's been enough of this. And there's nothing else that I can say. It's getting to the point where it's disgusting. We know enough about it now.
Ma'am, please pull your mask up if you, I'm
It's
gonna have to cut
up.
you off. It's not up, your mouth is exposed.
Where? I can't see my mouth. Like, all I fear is my air going up and clogging my glasses. That's all I'm seeing. So, I'm just asking to do something different instead of just going along with the same thing. You're not even trying anything different. You're not even giving it a trial period where maybe let's see if we can go without a mask. It's just, we're gonna do it because this is what they tell us to do, so we gotta do it. It just doesn't make any sense. You people all seem smart, but making stupid choices.
Is there anyone else who'd like to address the committee at open forum? All right, seeing no one, I'll entertain a motion to adjourn.
So moved.
Second.
Mr. Geddes,
Yes.
Mr. Domenici,
Yes.
Ms. Porto,
Yes.
Mr. Storrs, Mr. Larson,
Yes.
Mr. Withers, yes, Ms. Johnson.
Yes.
Mr. Hill.
Yes.
Ms. Sawyer.
Yes.